Welcome to Question Strategies for taking the CPC, the Certified Professional Coder exam from AAPC. This is part 3, so let's get going. Our first question has a gentleman who hurt his wrist skateboarding last weekend. It swells, and John finds himself it being hard to use the wrist. He went to his general practitioner, Dr. Bloomfield. The doctor had his staff take 2 views of his wrist, and when the tech is finished, the doctor reads the result. What code gets applied? Well, before we even pick our keywords out, you can look to see that 73100 is in every answer. Do you need to look it up? No. We will, though, but you don't need to. What you can see here is that this one is going to ask you a question relating to modifiers. Do I need a modifier? Do I not need a modifier? Do I need 2 modifiers? So we need to figure out what these modifiers mean. So first off, let's look at the keywords. We have general practitioner, Dr. Bloomfield. His staff takes 2 views of the wrist, so he's using his own equipment. And when the tech is finished, the doctor reads the results. So I need to know what TC and 26 mean. Now you can look in the front of your CPT book and you'll see some modifiers there, or you can go back to the appendices. Now I believe it's the first one for the modifiers, but you'll have to look to know for certain. The TC means technical component, and that means that somebody took an X-ray. And in this case, his staff took 2 views. And then the 26 refers to professional services. That's when a doctor comes in and he reads the X-ray. Guess what? That's all you need to fully perform an X-ray. Somebody to take it, somebody to read it. So we have B and C. Of course, B just has the technical component, which we know is not current, or not correct, I should say, because somebody also read it, which we had 26, which is C, but somebody took it. So that one's not correct either. Now we have D. D has a TC and a 26. Is that correct? No. Because somebody takes it, somebody reads it. That's the whole code. There's no need for modifier here. So we would use A, 73100, because the person came in, he had 2 views of his wrist made or done, and then the doctor read those results. So the doctor gets full credit for taking the exam and reading the results. Now, if he was working someplace and he wasn't a regular staff, he could probably put in that he just had professional services because he read the X-ray. But in this case, he's working for himself and it's his staff who did the work. So 73100 is the answer, and that's radiological examination, wrist of 2 views. And that is coming straight out of my CPT book. Here's another one. A 7-month-old infant is brought into the operating room to have a cleft lip repaired. What are the anesthesia CPT codes for the case? Well, this isn't too bad. We have 2 sets of code. We have 00172 and 0002. But we also have this 99100. So what is 99100? It is one of those qualifying circumstances in the front of the anesthesia section, which says this person is either younger than 1 or older than 70. So that's something to consider when we go into that. So we have a cleft lip repair, and we find that 00102 is anesthesia for all procedures involving plastic repair of cleft lip. Now, plastic repair, they're talking about, plastic surgeon fixing up the actual look. as far as the 99-100, we would use this here because if it told us not to, what you would see is one of those actual exemption parenthetical note telling us not to use it, and we don't have that in this case, so we would use it. The easiest way to know, am I on a code where I don't need 99-100 is because the actual code description will for someone younger than 1 year of age, then you don't need the 99-100 because you would be duplicating what you're saying. So in this case, we need 00102 for the actual cleft lip repair, and we need the qualifying circumstance to let every. Now here's kind of a long one. Starts off a 50-year-old female was sent to the operating room for a total hysterectomy. During the surgery, it was noted the woman had an increased number of adhesions that were located throughout her small and large intestine, making it difficult for the surgeon to proceed. Through the trocars, when you see trocars, that tells me it's laparoscopic, that were placed, the surgeon proceeds to not only complete the hysterectomy, but to release all internal structures from adhesions. This took an additional 30 minutes beyond what would have been logged for just the total laparoscopic hysterectomy with a uterus greater than 250 grams. What CPT code is assigned for this question? All right, well, let's start by looking at our keywords. We have total hysterectomy. We have adhesions. I threw trocar in there just to push the laparoscopic idea because when you're using trocars, that's when they're making the holes to use the laparoscopic tools. They did a hysterectomy, but they also had to release adhesions, which took an additional 30 minutes beyond what would have been just a total hysterectomy. So what do I use? Well, the fact that it said it took an additional 30 minutes tells me that's a modifier, that I need to tell the insurance company that this code was changed in some manner. In this case, it was because it took longer to finish than it normally would. So I definitely need modifiers. Now, I can tell you, well, let me look to see if I put them on the next one to begin with. Nope, I didn't. I can tell you that 22 is increased procedural services. If you look at 78 and 79, I believe those are modifiers talking about returning to the operating room, but in this case, that's not needed. It is a 22, it's increased procedural services. Now, do I need to look up the code in this case? No, not really. You can, but you don't have to. That's what I was trying to get at earlier on, that if you can figure out the answer without looking up every code, you're going to be saving yourself some time. Now remember, this test is a bit of a butt buster, so you do need to keep moving along. Here I have a 39-week woman pregnant with twins comes to the ED in active labor. The twins had decrease in fetal heart tones, and it was decided that she needed to have an emergency C-section. The doctor performing the C-section did not give her antepartum care or would give her postpartum care. She'll go to her doctor for that. So what CPT codes would you use? Well, let's take a look to see what kind of keywords we're looking for. 39-week pregnant with twins. I should have added woman, but I think you understand that part. And they're twins with decrease in fetal heart tones. This was an emergency C-section, and the person is not doing antepartum care or postpartum care. He is just there to do the C-section. Well, as I look at these without even looking up any of the codes, I can tell you right off the bat it's not A or B. Now, yes, there are two twins there, but think about it. When you do a ×2, that means the whole procedure was performed twice. So if we were to perform or pick one of those ×2s, we would be saying the doctor came in, opened up the woman, pulled one baby out, closed the woman, then opened her again to pull the other baby out. Now we know that didn't happen, that both babies were pulled out at the same time, and that the C-section was only performed once. So that tells me right off the bat I'm looking at either C or D. Now, I looked up both, and the first one, 59,510, routine obstetric care, including antepartum care, cesarean delivery, and postpartum care. Well, that's not the case here because we said this doctor just did the C-section. He did no pre-care and he's doing no post-care. So it would be 59,514, cesarean delivery only. In this case, we knew that it wasn't going to be A or B because of the times two. So then all we had to do was take our keywords and look to make sure that we chose the right code in this case. Okay, let's look at our last question. A patient comes to the ED and is diagnosed with Kaposi sarcoma of the skin. What ICD-10 codes would you use? This is an important one because Kaposi sarcoma is an HIV-related disease. Somebody who comes in with an HIV-related disease or an AIDS-related disease will show B20 first. That's actually in the codes. Let's go take a peek. Kaposi sarcoma of the skin is our keyword, but when you look up, I didn't include that. Well, I am so disappointed in myself. When you look up Kaposi sarcoma, it tells you specifically that you have to put in that this person has B20, human or HIV, positive HIV. So it would be B20 followed by C46. It would not be C46 followed by B20. The only reason you would have B20 come in after something, let's say the person cut themselves on the leg and they have to come in and get stitches. Well, that cut on the leg isn't necessarily from AIDS, so B20 would not come first. But in this case, B20 does come first because Kaposi sarcoma is age-related, and within the tabular index of Kaposi sarcoma, it tells you B20 comes first. The last two that you're seeing, the R75, I believe, is the positive results or inconclusive results, and Z20.6, one is the positive result, the other is inconclusive. But what I'm getting at is it is in your book, whenever you have an actual AIDS-related disease, that B20 would be shown first, followed by whatever AIDS-related disease the person's going through. Well, that does conclude this part of our review, and we will continue on.